How's it gangin' dudes and dudettes? My name is Sean. I'm gonna get right into the video because we have a lot to talk about, very important. So make sure you pour some gravy on the like button, smack the like, mashed taters for the share button. You know what I'm saying? We gotta get these videos out here. We gotta spread some truth to the people. So, as much as the Bernie Bros like to say what's going on with Yang's Medicare for All, and as many videos that they put out, saying that Yang is wrong and Yang needs to be corrected and Yang is lying and all these different little smears that they're putting out. I kind of thought that, being as I'm a Yang supporter, I should probably dig into this, right? I should probably dig a little bit deeper. So that's what I did. And, there's a lot of things that I think that, first off, they get really, really confused about, right? So, first off, everybody takes this holier than thou approach that if you don't support Bernie's 100% exact idea of Medicare for All, then, or his bill, then you're not for Medicare for All whatsoever. They take this straw man argument. So let's just take a look at Bernie's Medicare plan, right? Healthcare as a human right, Medicare for all. We say to the private health insurance companies, whether you like it or not, the United States will join every other major company on the earth and guarantee health care for all the people as a right. All Americans are entitled to go to the doctor when they are sick and not go bankrupt after staying in the hospital. I would agree with that. But there's really not a lot here to get through. So key points. Create a Medicare for all single-payer national health insurance to provide everyone in America for comprehensive health care coverage. Free at point of service. No networks, no premiums, no deductibles, no copays, no surprise bills. Not that there won't be no bills, just no surprise bills. Medicare coverage will be expanded and improved to include dental, hearing, vision, home and community-based long-term care, inpatient, outpatient services. The medical, the normal stuff. Stop the pharmaceutical industry from ripping off the American people by making sure that no one in America pays over $200 for a medicine they need by capping that American pay prescription drugs under Medicare for All. Seems like a pretty bold plan, right? Okay, so details. Today, more than 3 to 30 million people still don't have health insurance, and even more are underinsured. Even for those with insurance costs are so high, the medical bills are the number one cause of the bankruptcy in the United States. Incredibly, we spend significantly more on our national GDP than on this inadequate healthcare system. Far more per person than any other major country. Sorry, America is kind of like a company, isn't it? And despite doing so, Americans have worse health outcomes and higher infant mortality rate than countries that spend much less on healthcare. Our people deserve better. I would agree with this. So, he goes on to say the giant pharmaceutical companies and health insurance lobbies have spent billions of dollars on the past decades to ensure that their profits come before the health of American people. We must defeat them together. This means joining every other major country on earth by guaranteeing a health care for all people and a right, not a privilege, the Medicare for All single-payer program, right? And to lower the price of the prescription drugs, now we need to allow Medicare to negotiate with big drug companies and lower prescription drug prices for Medicare Drug-Free Price Negotiation Act. How patients, pharmacists, and wholesale dealers buy low-cost prescription drugs from Canada and other industrialized countries for the Affordable and Safe Prescription Drug Importation Act. Cut prescription drug prices in half and prescription drug price relief, and by pegging prices to the median drug price, 5 major countries, Canada, United States. Okay, so it seems pretty good, right? So you're like, okay, so why? So if we go to Yang's page, we should see so much. It should be just so much worse, right? He should be hitting none of these points. None of these points should be covered in his plan, because by what we've seen with the Bernie Bros, his plan pales in comparison. There's no touching it, right? So let's see. Oh wow, seems like there already is as much text. And the thing is, we can click my full plan. This is just the first page. Wow. So, we could go through all this, but I really just want to say that, a lot of times the Bernie Bros want to say that Yang doesn't support Medicare. He changed it to support the spirit of Medicare for all. But that's only because that a lot of the Bernie Bros have miscommunicated to the American people of what Medicare for all means. The Bernie Bros say it's as if it's Bernie's bill, and when people support that, they're supporting Bernie's bill. Not necessarily. People can support everybody having Medicare for all without supporting a particular bill. People can draft different types of bills. Bernie was not the original founder of this. He was not the original one to come out of the woodwork with this idea, right? So Yes, Yang is right. We are having the wrong conversation on healthcare. Instead of addressing the underlying problems driving unaffordability and access, we Democrats are spending all our time arguing over who is the most zealous in wanting to cover Americans, over who has wanted to do it longer, over who cares more about the health of Americans. He's already digging into Bernie right there. I love that. So we talk about how we're going to pay for it, but the reality is we're already paying for it. We pay for it when we can't switch jobs. We pay for it when new jobs. So he's 100% right with this. We pay for it when the healthcare costs drive us into bankruptcy. 100%. He echoes a lot of the same things that Bernie says. To be clear, I support the spirit of Medicare for all, and we have since the first day of our campaign. I do believe that swiftly reforming 18% of our economy and eliminating private insurance for millions of Americans is not a realistic strategy. So we need to provide a new way forward on healthcare for all Americans. Now, before we go any further, I would have to say that a lot of Americans just don't support Medicare for all. And there was a poll that said 70% of Americans support Medicare for all. But then when you get into Medicare for all, they kind of really don't. So the Kaiser Research Institute, 56% of the country support a national health plan, sometimes called Medicare for all. And even a larger 71% supports the idea when told that it would guarantee health insurance as a right to all Americans. When told that such plan would eliminate health insurance premiums, 67% say they're in favor. Now down here it says, but the more revealing part of the survey, I think, comes from the questions focused on the cost of single payer, all of which caused support for Medicare for all to drop below 40%. Told that it would eliminate private health insurance and require people to pay more in taxes, for example, support fell to 37%. And then they were told that it would cause some medical treatments and tests to be delayed. Support dropped even further to 26%. Now, what we could say is something like, a lot of cities have a city-run bus depot, and you can pay a cheap amount of money to ride the bus. You save money on gas. You don't have to buy a car. You can take the bus everywhere you want to go, but you're going to have long lines. You're going to have to be sitting with other people. You're going to have to, go at the behest of the government's schedule. The same thing was going to happen if it was Medicare. There's going to be so much more red tape. There's going to be just long lines, long waits. It happens. There's plenty of countries in Europe who do complain about this, whether people want to say so or not. Whether it's a trade-off or not, it's a different story. But the way it works in America right now, you could pay a little bit more to not have to sit there and do all that kind of stuff. Whether that's a good thing or not, it kind of is irrelevant whenever most people support it like that. You see what I'm saying? So yeah, you guys can stop. You guys can read this full thing if you want to. But let's click the full plan. Now, one would say if Bernie's is so much better, why is his website got one page on it? Yang is sitting here going in depth. He has the math. I could sit here for an hour on this video and just sit here and demolish every single thing that Bernie has going, because you have to actually go through other sites to research what Bernie actually what his stuff will actually do, because he doesn't just lay it all out. Yang does. He does not shy away from it. Bernie is shying away from it. On top of that, Yang wants to get rid of lobbyists. He wants to 1, control the cost of life-saving prescription drugs. He wants to 2, invest in technologies to finally make health services function efficiently and reduce waste by utilizing modern services like telehealth and assisted technology. Number 3, he wants to change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practitioners. Shift our focus in educating ourselves and preventing the care and end-of-life care options. Ensure crucial aspect of well-being, including mental health care for all of people with disabilities, HIV, AIDS detection, treatment, reproductive health, maternal care, dental, vision, address. So he's... every single thing that Bernie wants to get done, Yang does all that, explains exactly how he's going to do that, how he wants to do all that. And then, to top it all off, he wants to diminish the influence of lobbyists and special interests in the healthcare industry that makes it nearly impossible to draft and pass meaningful healthcare reform. So, without me being boring, you guys, and just reading through all of this, Yang gives all of the stats, all of the math on how every single one of these things could be done, and it effectively does every single thing Bernie does, while not uprooting 18% of the economy, while having bipartisan support, while going further on lobbyists than what Bernie would go onto. So in the end of it, Yang just wins. He wins, and the proof is in the pudding with the new poll from Kaiser Research Institute. Overwhelming majority of Americans don't support Medicare for all when they realize all the changes and sacrifices that they will have to make. Whether you agree with big tech and big pharma being greedy, evil, horrible corporations, I might agree with you, but just uprooting 18% of the economy would never pass in the House. So what you got to do is you got to find that middle road. You got to find something that will phase out the horrible healthcare insurance industries that are crippling our Medicare. Right, so that's what you have to do. You have to phase it out. You can't do it overnight. And Bernie has like a 5-plan year. That is a blip in the political sphere. It's not, you know what I mean. So yes, he has all the stats. There's nothing else I can say about that. Other than just the fact that people will attack Yang on these issues when they're really not issues. You just look at the facts. Just go to the pages and you can see why would Yang have all of this stuff laid out. He's not afraid to shy away from the facts. Bernie has a couple bullet points. He's the one who wrote the bill. Should you have page upon page upon page upon page about how it's supposed to do things and how it's supposed to correct stuff and how it's supposed to fix things? It does not do that. So with the proof from the Kaiser Institute, Yang has bipartisan support. So therefore, that's proof that Yang crushes Bernie Sanders with his healthcare policy. So it is what it is. I know some people's going to be salty, but that's all I got for you guys. I appreciate you.